Baruch here with genConnect.com, and we're talking today with Dr. Mitch Besser, the founder of Mothers2mothers. How are you, Dr. Besser?
Very well, thank you.
So tell me, what really is the key to stopping the transmission of HIV from mothers to their children?
I think there are a couple keys, Baruch. I think one of them is around education. I think we need to ensure that mothers who are at risk for getting HIV or who have HIV are adequately educated about the treatments that are available to them, and then take advantage of those treatments.
What really, though, are the cultural stigma attached to having HIV for these mothers that could often get in the way of taking those necessary steps?
Well, the stigma around HIV is immense. Women who are infected with HIV are frequently unable to tell their family members or their partners, and so they live silently with HIV. That interferes with them getting care. They can't take medicines, they can't take care of themselves and their babies as they best could because of the stigma. So we need to find ways to change the way people perceive themselves living with HIV, and also the way societies perceive people who are HIV positive.
Let's talk for a second about the results that Mothers2mothers has seen as an organization.
Sure. Mothers2mothers is an organization that provides education and support to women living with HIV to ensure that they do get adequate health care, that they take the medicines that are available to them. We strive to ensure that mothers don't have infected children and that they can stay alive to raise their kids. We find that the women who come to care and who see our staff, our mentor mothers, and our staff are mothers living with HIV who are care providers. Those women stay in care. They get the medicines they need. Their babies are more often HIV negative. They are able to get the medicines they need to keep themselves healthy and alive. So that we're seeing a transformation, that women who come in fearing for their own lives and for their children's lives are now viewing the world positively.
Dr. Besser, you could have just created a very successful practice in the United States, lived comfortably. Why did you decide, what inspired you to take this next step and instead of just staying with a traditional practice, really create this Mothers2mothers organization?
I think, Baruch, I think it's two things. One is, we have a choice to take care of patients or populations. And I think one of the things that excites me is how do you take care of not just patients one at a time, which is very important, but how do you take care of populations of patients? The other is, I was fortunate growing up in this country. I had the best education. I had opportunities that people in most of the world don't, and I felt there's an opportunity to pay back. There's an opportunity to bring something to the world to try and give other people a chance to live better lives.
Dr. Besser, thank you for doing that. And for more with Dr. Mitch Besser and to learn more about Mothers2mothers, be sure to check out genConnect.com.